Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, today Emily Singer, veterinarian and author, joins me to chat about how to navigate pregnancy and practicing. We chat about the potential hazards, how to handle those first 12 weeks where you might not be sharing the news with everyone, and her tips and advice on coming back to work after maternity leave. Before we head over to my chat with Emily, a quick reminder that we have some free webinars available to the vet rehabber community. These will be changing soon, so if you've not had a chance to check them out, go to onlinepethealth.com/free. They are Improving Post-Operative Recovery with PEMF Therapy with Lani Alvarez, Your Health as a Hydrotherapist and How to Look After Your Back, and Equine Cupping with Diane Lanscroon. A quick word also from our sponsors. Curacao Vet's founder and CEO, Dr. Nada Robinson, has been teaching science-based integrative medicine for nearly 25 years. She first developed her courses at the Colorado State University, where she started the Medical Acupuncture for Veterinarian Certification program in 1998. And in so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture, the first of its kind. Today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. Courses include medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Curacao Vet at curacao.org. Right, over to my chat with Emily. Hey Emily, thank you so much for joining me.
Thank you so much for having me. It's so great to be here.
Emily, for the listeners, won't you just introduce yourself and share your journey with us?
Sure. My name is Emily Singler. I am a mom of 4 kids and a veterinarian. I graduated from vet school in 2005, and I live in the United States in Florida. My journey as a parent really started very close to the beginning of my career as a veterinarian. I found out I was going to become a mom just about 3 months after graduating from vet school. So I was just a few months into my first job when I found out I was pregnant. So at that time, I really was still kind of learning the ropes in terms of my particular job and just how to be a veterinarian, and very much wanting to prove myself. Still getting a lot of questions from my clients about whether I was really a doctor and whether I was old enough to be a doctor. And then when I found out I was pregnant, I really didn't know what to think. I didn't know what to expect. Even though I was very excited and happy, I was also very, very anxious, very worried, both about what that was going to mean for what I needed to do on a day-to-day basis, working in the clinical setting, but also what that would mean for my job, what that would mean for my professional life, and just how I would make it all work. So as I was going through that experience, I just found that there were not a lot of people, or really anyone in my close circle, who had been through that experience before, who really understood what I was going through and, could help make that a little bit easier by sharing their own experiences. So that was kind of the beginning of what ended up being my desire to try to gather information and start talking about some of the resources and some of the struggles that we all go through when we are working, particularly in veterinary medicine, during pregnancy and and beyond, as a parent, because there's a lot that goes into it. And I think the more that we kind of stay isolated and stay in silence and don't know what others have dealt with, and that we're not alone, the harder it can be for everyone. So eventually, this is now 17 years later after having my first child, I wrote a book, Pregnancy and Postpartum Considerations for the Veterinary Team. And that came out in November of 2023. And it's really meant to be a resource for those who are navigating their pregnancies, who are planning to become pregnant, or even just thinking about it in the future, and also for those who work with them and employ them and support them in veterinary medicine, so that they'll have more access to resources that can make their life better.
Well, firstly, is congratulations on publishing your book.
Thank you.
That's really quite an achievement. It's one of the things still I have to tick off on my list. Looking back, I've practiced as a primary veterinarian, and my field now, as you know from the podcast, being a veterinary rehabilitation podcast, is more in the field of rehab. And that looks really different, the way that we practice. But just thinking about my early months and the first few months that I was a veterinarian, I just can really appreciate how overwhelming it must have been for you to be pregnant in those days, because it was hard enough just to cope with, the changes from being a vet student into practicing and the responsibilities. And I just remember how bad I felt when I was pregnant. I've had 3 pregnancies, well, more pregnancies, actually 4 pregnancies, but I've got 3 kids. And all of those, I've felt really, really nauseous. I mean, the morning sickness has been really bad. And one of those, actually, I had my own practice. The second one, I was sort of phasing out and taking a sabbatical. But the first one, having to practice with morning sickness was just, I can't even explain how bad it was for me. I just remember just going to the bathroom like every half an hour. And then I drank a whole lot of ginger tea. I used to just sip ginger tea, whether it was warm or whether it was cold, or eat ginger sweets. That was the only way that I got through that. So yeah, it's amazing for me, like just thinking as being a veterinarian and having to operate and stand a lot. As a vet rehabber, we get to practice more sort of on the floor, which has its challenges, which we can discuss when you are pregnant. But you're not standing a lot. You will stand every now and again and do exercises, but you're able to sit down. Whereas a veterinarian, you're on your feet virtually the whole day. I mean, you're very lucky if you get a chance to sit down, whether it's just to write some notes or every now and again some type of surgery where you get to sit down. But I was one of those vets that was standing most of the time, whether I was operating. So what are the biggest, challenges that you had in those early days when you were pregnant? What were the thoughts that were going through your head, and what are the things that you were worried about?
So there are kind of like 2 categories. I mean, there were definitely some concerns about, physical health and safety and, the health of my pregnancy. For example, during my first pregnancy, I was working at a humane society, and we were taking x-rays of a patient, and I was in the room just helping to position, I think it was a dog, and nobody knew that I was pregnant. And the technician accidentally took an exposure when I was standing, right next to the table. Obviously not wearing any kind of lead gown or any kind of personal protective equipment. So little things like that were concerning to me. I was doing spay neuter surgeries every day, pretty much all morning long. So I was concerned about isoflurane exposure. And when I asked I was seeing a nurse practitioner at the time for my pregnancy, my antenatal appointments, and she didn't know what isoflurane was. So she certainly didn't really know how to how to advise me as to, whether it was safe to be around or not. I definitely had quite a bit of morning sickness during some of my pregnancies. I've worked through 5 pregnancies. I have 4 living children. And I can remember one pregnancy where, at least for a while, I was so dizzy that I could barely every time I stood up, just the whole room was spinning. So those were all challenges. For some reason, I was just very, very stubborn about, and I'm not saying this is a good thing. This was not really something I'm proud of, but just I was very stubborn about not ever letting it, you know, not ever allowing it to make me miss work. I think there's definitely a lesson there that it's more important to just take care of yourself than, try to be a martyr. But I would say my biggest concern, even more so than the physical hazards and just how I felt during pregnancy, at least during my first couple of pregnancies, was what did it say about me as a professional, and what was everybody going to think of me, and were they going to treat me differently, and were they going to judge me for suddenly having this new priority that might take me away from veterinary medicine. Now I obviously think very differently, but in my younger days, when I was, again, still trying to prove myself as a professional, that weighed very heavily on my mind. I was very concerned that at one point I thought I would lose my job because I had been there for such a short period of time and I didn't know what the laws were that would protect me, or just that even nobody really, most people don't do that. They don't fire you because you become pregnant. I don't want to say that never happens, but most of the time it doesn't. So I was just very concerned about, would people still treat me with respect? Would people still take me seriously? Would everyone just be terribly disappointed in me? And how would I convince everyone that I'm still a dedicated professional? I was very worried about that, particularly during my first pregnancy. But then immediately after I had my daughter, I was just overcome with these feelings of, how am I ever going to leave her? And how am I ever going to go back to work? Because suddenly I don't care about that anymore. Suddenly I don't want to. And what am I supposed to do? And how does everybody do this? I mean, and these feelings just kind of consumed me for a while. So it was very hard to work through that. And looking back on that, I really went through all of that alone. I did not talk that through with anybody who could really help me. I didn't know if anybody else was feeling the same way. So just emotionally, that was a very hard time, trying to really kind of ask myself, like, what is important to me? What do I want to do? How am I going to make this work? Am I going to, go back to clinical practice, which I did, more at first, at least out of necessity. I needed to keep working. I needed a job. And it took me, I would say, a few years to get to the point where I felt, you know what, this is what I want to do. And I'm making it work however it is that works best for our family. But it took me a while to work through all of that. And I would not wish that on anyone, trying to kind of suffer like that alone. And I don't want that for anybody else. So that's a big part of why I'm doing what I'm doing now.
Yeah, as you were saying it, explaining how, you were worried about how it was going to work. And I must say, I was quite naive, I think, when I was pregnant. I remember having, during my maternity leave, I had my own practice. So pretty much working still and doing admin and things. But in my mind, I had all this time, I was going to build a new website.
Yeah.
I was going to do all these things. And then, when you get into it, you suddenly realize you actually absolutely no time, like no time at all. You know how it is. It's just like, you're lucky if you can shower in those early days.
Yeah.
And, that shift in, where work was your main thing that you did. And, I was at that time when I was pregnant, I was also canoeing. That was my sport. And it was literally just canoeing and gymming and training and doing races and my work. That was it, And then suddenly this little person comes into your life. And I remember actually just having this moment where I was just like, this is actually what it's all about, like this is like what, yeah. And I suddenly, like, before I thought I had a purpose, I suddenly realized this is my purpose, like that was just the most important thing to me. And I must say, I had my own practice at that time, and it really was really difficult, because my patients and my clients were also so important to me in my practice, and I'd built my practice up. It was very busy. I had a long waiting list for people wanting to see me, and trying to juggle, spending time with my little newborn baby, and still carrying on this life of the canoeing and the training just literally stopped instantly, and there was just no time for that. It was either work and the little one. And like I didn't really have anyone to talk to. And if I look back now, I feel like it was a huge struggle. I didn't know how to put it all together. I didn't know how I was supposed to do all of it. I had my first child also had health problems. She was in and out of hospital, which was also challenging. But there really is hard. It is, and you're just torn. Like you want to be there. I mean, you are there. That's what happens. You just have to say, all right. Sorry, the practice and clients, like this little one needs me right now. But it is difficult, and I think it's very different when you own your own practice compared to when you're working for somebody else. If you've got other people in the practice that can support you, there's still those feelings of guilt. I don't think that's any different, not being there for your patients when your little one needs you. But I think, with our profession now, it is very female driven. I think I don't know what the stats are. Maybe but I think we have more women in our field now, and definitely in the vet schools, high percentage of
without
women.
a doubt. Yeah, without a doubt. I need to know those numbers. I don't know the number right now, but I want to assume, I don't know. I don't want to say something and be totally off, but it's definitely skewed more.
Yeah.
More female at, not just veterinarians, but, support staff, veterinary technicians, CSRs.
Yeah, and having
practice managers. Yeah.
I mean, having a family is part of life, I mean, women have kids. One thing that's very interesting is that we recently did a vet rehab industry reports. So we had 652 vet rehab therapists, and these could be either veterinary nurses, veterinarians, veterinary physiotherapists. So they're all in a whole lot of professions that come in to make up the veterinary rehabilitation therapists. And some of them are equine, some of them are small animals, some of them are mixed. So 652 people filled in the survey. And what was interesting is 54% were over the age of 40 and 46% were between 20 and 40. And of those, 94.8% were female. So of the 652, 94.8% were female. And this is where it gets really interesting. We asked them how many children they have. All right. Now, remembering that 54% are over the age of 40, 46% are 20 to 40. So, a lot of those are in sort of the age where they would be having children. 60.4% had no children. And I must say this was a huge surprise for us. When I saw these stats, I was like, I actually can't believe it, that 60% of the people that are vet rehab therapists that filled in the form didn't have children. 23.5% had 2 to 3 children. 2% had 4+, and 14.1% had 1 child. And when we were looking at those, we were sort of questioning, does our profession, and I think veterinarians and vet rehab therapists are very similar. It's a similar type of profession. It's long hours. It's, it takes a lot out of us. Does it actually support raising a family? Is it that, people nowadays are choosing a profession over family? But it was a big question mark for us, this stats of 60% not having kids. And we don't know whether they're just choosing not to, or our profession doesn't actually allow it. They get into the profession, and because it's so long hours and so hectic, they just put it off and then never have kids. What are your thoughts on that?
I think that, I have a few thoughts. I think that it is very challenging. It is definitely very challenging to raise a family and work in particularly clinical practice. We all know that there are, plenty of other ways that veterinarians use their degree. And I'll just say that, it's hard no matter what you're doing. It's hard to raise children. It's hard to have a family. I just want to acknowledge that. Things about veterinary practice that make it particularly challenging are the long hours, as you mentioned. It's extremely common for shifts to be at least 10 hours long, if not 12. And we all know that however long the shift is scheduled to be, it can often be longer than that if we have to stay to accommodate running behind, doing notes, making follow-up calls, that kind of thing. And some shifts are, 12 to 14 hours for those who work in the emergency setting and that kind of thing. So the long hours can be very challenging because someone has to be able to drop off the kids, pick up the kids, not to mention the fact that you want to see your children while they're awake and be able to really kind of have time with them, because otherwise, what's the point, to an extent. I think that, so you made a comment about, it's women have children, and as to why 60% in your study did not have children, I would imagine that there are a variety of factors that go into that. Certainly among veterinary professionals, probably most of the population that's in like their 20s is going to be very low in terms of having children, just because they're still in their professional training and they want to get out and they want to start working. I mean, I had my first child when I was almost 27. And so just in general, you're seeing a push towards having kids later in life, which unfortunately can make it more challenging for some people because our fertility starts to decrease as we get a little bit older. So that may be a factor. But I'm definitely seeing, just in general, and this is not any kind of, scientific study, it's just my own anecdotal observation. I'm seeing a lot of people choose not to have children. And some of it may just be because that's the lifestyle they want to lead. But some of it may also be because they don't feel like they'd be able to give the time and attention that they would want to, or concerns about other things that are going on in the world that they don't want to bring children into. I mean, I think there are probably a million different reasons why, but it's probably a combination of things. But the other point that I really like to bring up is that I think we really need to intentionally kind of shift the dialogue about, women have children, because, I mean, it's really all of us. I think the women get kind of pegged as the ones who deal with the kids, who take care of the kids and that kind of thing. And obviously they're, for the most part, the ones that get that are pregnant and giving birth. But we need to start kind of roping in all the parents, whether they identify as male or female, otherwise, whether they're birthing parents, whether they're adoptive parents, whether they're welcoming children through surrogacy, that kind of thing, and really kind of associating that, the responsibilities, the needs, all that kind of stuff that go along with parenthood with everybody, everybody who chooses to have that as part of their life, because I think that is going to be one of the big things that will help to reduce the stigma and also just the mental load and the burden on mothers and women specifically. I know within our profession, we're probably going to continue to be skewed female for the foreseeable future. But I think one of the ways we help is really try to work on gender equity, and not just always assuming that it's going to be the mom, that it's going to be the woman who will be the one bearing the primary childcare responsibilities, the one who is going to want a more part-time schedule, the one who's going to want to leave on time or leave early, the one who's always going to call out when their child is sick. Certainly there's nothing wrong with those things happening, but we need to kind of give permission to men and fathers that they can do those things too, and that we expect them to do those things, so that we kind of even the playing field a little bit. We want fathers and men to take parental leave, and trying to shift away from calling it maternity leave and paternity leave and just call it parental leave, so that everyone feels like they can take it, so that we're not judging men when they try to do those things too. Because that's ultimately just going to help everyone. That's just my little soapbox.
No, I love that. And I think in some countries in the world, it's a lot more accepted than others.
Mm-hmm.
Like
Definitely.
my father-in-law lives in Sweden, and in Sweden, it's very common that both parents do, they look after the kids, and they have, the fathers, they're actually able to take, and I think it's actually a year. The woman is allowed to take 3 years. So it's not completely equal, but the woman can take 3 years of paid leave as a maternity cover. Not 100% salary. It's a decreasing. I think it's like 100, and then it's like 80, and then 60 the last year. But the father is allowed to take take a year of paid leave too, and not at the same time as the mother. And so which actually is good, because then it allows the father to actually be a primary caregiver for that period of time, and for him to realize, what he needs to do, and the kids to be used to the dad, being a primary caregiver while the mom is at work.
Yeah.
So that's I remember when I heard that, I was like amazed. I was like, wow. I don't know that all the dads do it, but a lot of them do, I think, So yeah,
Well, when
more
it's
accepted.
normalized, when it's considered to not be something taboo, not something you're going to be, just like I was worried when I started my profession, like, what are people going to think of me now that I'm pregnant? What are people going to think of me as a veterinarian, as a doctor, now that I have, a child? Are they going to think less of me? If men don't have to worry about that, if they're not going to think, well, how is this going to hurt my my professional development? How is this going to hurt my career? How is this going to hurt my ability to, be productive and take care of my family? If we can remove some of those concerns and make it more common, then I think you will find a lot more men saying, hey, I want to be part of this too.
Yeah.
I want to do it too.
Can we go through?
So I think we have a ways to go, but hopefully we'll get there.
We will. We will. Can we go through sort of the phases of, like, obviously finding out that you're pregnant, and then usually there's that period up to like 12 weeks where we don't tell anyone. Can you give someone, the listeners, some advice on how to navigate that period, where you might be telling family, but you're not telling people at work yet? What is your best advice to get through that period, remembering that often it is doubled up with nausea and morning sickness, and you're often not able to share that with your colleagues?
Well, I guess my first thought would be to sort of challenge that idea a little bit, even though it is still very common, this sort of concept of you don't say anything until at least 12 weeks or 14 weeks, whenever you consider to be the end of the first trimester. And I understand the reasoning for it. That is certainly when the risk of pregnancy loss, miscarriage is the highest. And there is still this sort of sentiment that, well, I don't want to tell anyone, because what if I lose the baby? And then I'll have to tell them that I lost the baby, and then that will be awkward, and I'll have to go back and tell everyone, and I wouldn't want anybody to know. My thoughts on that, I mean, first of all, in clinical practice where you are exposed to some workplace hazards, and like you said, you may not be feeling well, because the first trimester typically comes with, even if you don't have nausea, which many people do, just profound fatigue that can make it very hard to keep up with the pace that you would typically maintain in practice. And then if you've got the nausea on top of that, it can make it really challenging. And then on top of that, potentially you might be normally participating in activities like helping to restrain a pet for radiographs, or handling, a big, very boisterous fractious dog, or a stressed cat, that kind of thing. Things that, or, examining a pet that has ringworm or some other zoonotic disease that you'd really rather not be exposed to. If you're a large animal, you might be handling injectable prostaglandins, which you really don't want to have any accidental exposure to during pregnancy. So there are plenty of situations in which it would really be ideal for you to have some kind of accommodation, or to at least make some intentional change in how you do things. And it can be, not always, but it can be harder to do that if nobody knows that you're pregnant. So again, I completely respect that everybody's situation is different, and there's not just one right answer. But my suggestion is to at least sort of challenge that idea in your own mind of, is it really best for me to wait to tell everybody? It doesn't mean you have to tell everybody, but would it be helpful for me to tell my manager, my boss, somebody, so that they are aware, this is what's going on with me, this is what I think I may need right now, whether it's a little extra time to sit in between appointments, whether it's having someone step in for me when, radiographs need to be taken, or declining certain cases if they might involve, injectable medication that I don't want to handle during pregnancy, or just asking someone else to do that. Whether it's I'm going to need some extra time for appointments because I have extra medical care that I need, or understanding if I'm a little bit late one day because I was just feeling terrible terrible. All of these kinds of things are going to be much easier for someone to help you with in the workplace if they know what's going on. And so again, every case is different. Not everyone feels completely confident that their manager or their boss would be a supportive person. And I think that's worth thinking about too. If you don't think that they would treat you well once they know that news, maybe that's a red flag right there. But I think it can be very helpful. You know, there are in various countries different laws that protect pregnancy as a condition that you cannot be discriminated against in the workplace. And you really have a lot of those protections, but your employer can't be expected to uphold those protections if they don't know what's going on, if they don't know that you're pregnant. And then the other thought is back to the sort of the miscarriage, the pregnancy loss piece. I myself experienced a late miscarriage at 16 weeks during my third pregnancy. So everybody knew that I was pregnant. Everybody knew. And so then I did have to go and tell everybody that, that I had lost the baby. But it affected me so profoundly that I could not have pretended like that hadn't happened. And so for me, it was helpful that everybody knew what was going on in my life, particularly the people that I spent, most of my waking hours with on a lot of days. It was helpful for them to know what I was dealing with because I could not have just pretended like that didn't happen. And there is still some taboo around talking about pregnancy loss. And I think that just needs to go away completely because it's such a common thing. And we need so much support and understanding and love. My boss really pushed me to not come back to work right away, even though I kept saying that I was fine and that I could do it. And he could tell that was not the case. His family brought me dinner. They took care of so many things for us. And so I really felt kind of wrapped in a big hug from my clinic when that happened. And again, I could not have just walked in there when I came back to work and pretended like that didn't happen. So for me, at least, it was helpful that everyone knew because they knew what I was dealing with and they knew that I needed that extra support. That's just, again, my experience. Others' experience may be different. But to your question about kind of how to navigate that time. It's a lot about being intentional, about just taking care of yourself, realizing that the nausea, the fatigue, these are not things that you can always just push through. This is not like a mental game where you can just be really tough and it'll be fine. You need to take care of yourself. You need to drink a lot of water. You need to sit down more. Maybe you need medication for nausea, depending on how severe it is. Or like you said, ginger and some of the other over-the-counter stuff that can help. Maybe you need to change your schedule depending on what's going on and how, some people get severely nauseated and need medical treatment for that. And then apart from that, it just kind of depends on what your regular responsibilities are. Do you have, if you're a veterinarian, do you have a lot of support staff who's doing most of the technical roles where you can come in, do your exam, do the talking, do the, the diagnosing, the prognosing, make your treatment plan, and then you step away. If that's already your scenario, then it may be very easy to continue that. If you don't already have that, then you may need to, find ways to sort of recruit more support so that you're not pushing your body more than it can really handle kind of in that phase of your life. I don't know if I answered everything in your question, but I think it looks different for everybody. And it's sometimes, you just need to be the one to speak up and say, hey, this is what I need. And it's not a sign of weakness. It's not, I didn't want to ask for anything during my earlier pregnancies. I just wanted to be tough and I just wanted to prove that I could do it. And I didn't need any help. And looking back, I'm like, why did I make that so hard? Why was I so stubborn about it? I should have just told people how much I was suffering and they would have helped me.
I think for me, one thing
kind of get into that mindset, unfortunately.
Yeah, one thing that sticks out what you said is don't try and be tough, listen to your body. I definitely think in my first pregnancy I didn't, and then I got a lot better at it once you've gone through the first one. Okay, and just that overwhelming fatigue is really hectic. You were mentioning earlier about hazard, and I think that this looks probably a little bit different for the average vet rehabber or vet rehab therapist, because, you know, we're not exposed to radiographs generally, depending on the practice that we're working in. A lot of time we're doing underwater treadmill exercises. We have exposure to lasers and things like that. But, you know, often not exposed to isoflurane, anesthetic gas, but we might be, because sometimes we have rehab facilities that are attached to veterinary practices. We might need to walk through to go and collect patients, and we might in that interim get exposed to some of those hazards. Can you just run through the hazards that, you know, just off the top of your head, that people should just be aware of, even though a lot of them might not be sort of relevant to the vet rehabber, but it could be if they're at a practice or if they're visiting a practice?
Sure.
Yeah.
So starting with radiation, I would say if you're following the proper precautions, if you are wearing personal protective equipment, if you're trying to minimize your time in the radiology suite, if you use sedation when you can, and try to, you know, reduce the number of exposures you're taking, all those things that we teach, you know, the ALARA principles, as keep the dose as low as reasonably achievable. Typically the risk is low. You know, anyone who is intentionally involved in taking radiographs and they're pregnant needs to wear an additional dosimeter underneath their lead gown, and that needs to be checked monthly. Certainly just walking by the x-ray suite when an x-ray is taken, I mean, I would not be worried about that at all. I wouldn't try to hang out there while that's happening, but you know, sort of accidental exposures, one-off exposures, or even, you know, repeated exposures when you're taking the proper precautions, the risk is likely to be very low. Anesthesia, as long as the scavenger is working well, the scavenger equipment and the machine is tested for leaks, and we're not, you know, boxing down or masking down all the patients, again, the risk is going to be low. So sort of the biggest exposure risks are when you don't have a working scavenger, when there are leaks in the machine, anywhere in the circuit, when we're not intubating our patients, or when they're recovering and when they're first extubated, the patient is going to be giving off a lot of that waste anesthetic gas. So that would be a situation. You don't want to be sitting on the, you know, on the floor holding your patient while they're recovering from anesthesia if you're pregnant, because they're going to be breathing off a lot of that isoflurane, sevoflurane, whatever it is. But again, certainly walking by the surgery suite, even walking into the surgery suite, very, very low risk when those precautions are followed. Infectious disease, certainly a concern. So the recommendations there, I mean, it really depends on what the condition is. You know, we're exposed to all kinds of things. I'd say a lot of the bigger risk ends up being, you know, kind of the large animal work where you're investigating like aborted fetuses and that kind of thing. A lot of those infectious diseases that can cause that to happen in animals can also cause that to happen in humans. So, you know, one of the recommendations I make in the book for a lot of those conditions is, if you're being called out to a farm because an animal has unexpectedly aborted their fetus, that's probably not something you should be doing as a pregnant individual, because contact with the animal or the aborted fetus or any of their bodily fluids or anything like that could create a risk for exposure. You know, but then there are other things like leptospirosis, brucellosis, things like that small animal practitioners could have some exposure to. I mean, it's mostly about understanding the risk with certain patients, using good hand washing and other hygiene, and then just talking with your provider, your healthcare provider right away if you're concerned. But I think the rate of anything, you know, those kinds of things actually happening and causing a problem, again, is very low. But that's partly because we know how to make good decisions, and it's important to, you know, keep learning how to do that so that we can keep that risk really low.
About cats, treating cats, you know, often in vet rehab we will do rehab for cats, so toxoplasmosis, see a risk?
Yeah. So toxoplasma, definitely something I cover in the book. Treating cats though really does not increase the risk. I mean, it's exposure to their fecal material, which we sometimes handle. So being careful about that is wise. I mean, certainly not all cats are shedding toxoplasma all the time, and the oocysts in their stool take anywhere from 1 to 5 days to become infective. So kind of right after they've passed a bowel movement, they're typically not going to be infective. So wearing gloves, washing your hands, those are the main things. I mean, the higher risk activities for toxoplasma are going to be handling raw meat, gardening outside, contact with soil, those kinds of things. Again, washing your hands typically lowers the risk a lot, but just working with cats, handling cats typically is not considered to be an increased risk.
And one of the things I found really challenging was we work on the floor, right? So not all of
Mm-hmm.
us, but the large majority of us that are small animal veterinary rehabilitation therapists
Mm-hmm.
will sit on a mat on the floor and treat. And then depending on how big you are, and I don't know how people who have multiple, so like if they've got twins, I don't know how. I don't think it's
Yeah.
actually possible. But I mean, with my first one, she was Frank Breech, so head up and
Mm-hmm.
feet there, and so and she was big. She was a big baby, and I
Mm-hmm.
literally got to stage, I think it was about 32 weeks. I ended up on bed rest, probably because I wasn't listening to my body and I wasn't resting.
Yeah.
But I got to the point where actually being able to treat and lean forward, to be able to treat and being able to do the treatments just became limiting. What is your advice around that? I mean, when do you advise veterinary professionals to take leave? Is there a time where, I think it's different when you're standing. Maybe, I don't know. I think maybe you get to the point where you can't get to the edge of the table, Yeah, just
Yeah.
give us some advice about that. And we tend to want to stretch it as long as we can so we can have a longer time with the baby. But sometimes maybe that's not actually in the best interest of you. What do you advise about that?
So I don't think there's one right answer for everybody. I mean, I certainly worked up as close as possible to giving birth as I could in all of my pregnancies, for the reason that you just identified, that I wanted to have as much of my maternity leave as possible once my baby was born, before I had to go back to work. So, and a lot of people do really well, working right up until the end of their pregnancy. I mean, yes, I can remember doing surgery and like you can't get close to the table anymore. So that's a challenge. And so I wasn't taking, really long procedures, and I was, doing probably mostly like cat spays and things like that at the end. So there's definitely some case selection that happens. I was telling them toward the end I wasn't going to take like the really big, either super hyper excitable dogs that were going to jump all over me, or the really fractious, nervous dogs who, I mean, I like to give those dogs medication anyway. We don't like to we don't wrestle dogs.
Yeah.
But those cases, I would try to avoid at the end of my pregnancy, when it would just be physically harder to deal with them. I can remember during one of my later pregnancies, I started just rolling around on one of those like stools on wheels. I'd be like, just bring me the dog and or the cat, and I'll just, they're either on the table or they're in front of me on the floor. Most of the time, you're, as a veterinarian, my technician, and even a lot of time, like if I was on the floor, they were helping me up.
Yeah.
They would give me their hand, they would help me up. I did do a lot more sitting. I tried to put my feet up when I wasn't working on stuff. I mean, my staff during my pregnancies was really good about being like, no, you go sit down. I'm going to do this. I've got it. I know a lot of people who wore like compression socks, compression hose. I don't have any experience with that myself. I probably should have used them during my last pregnancy, but to kind of help with circulation, help to prevent swelling, that kind of thing. I was actually pretty comfortable on the floor, but I wasn't there all day. It was just more about like the getting down and the getting up.
Yeah.
So I think it really depends on the kind of work that you do and how your particular pregnancy is going. Because like you said, some people do need to stop working because of physical limitations or other health problems or concerns about the baby. I just don't think that there's a one size fits all answer, but I think if your pregnancy is going well and you're comfortable with it and you have the appropriate support, I think most of the time there's not a reason why you can't keep working.
Yeah.
I certainly don't ever tell people that they need to stop working, at a certain point.
Yeah, I think you need great support. That's it. Having
Yeah.
team members that can
Yes.
support you. So let's transition to now you've had the baby and now you're having to go back to work. Any advice to just decrease the stress of that? Just whether it be emotionally or practical advice that you could give.
Yeah. So whenever that is, when you're at the point of going back to work, my advice is to think about and talk about this with your employer if it's something that you think you would benefit from. Do you want to do any kind of gradual reentry? So that means if you normally work 4 days a week, do you want to come back for a couple weeks where you're just working 1 or 2 days a week, or where you don't stay all day? Sometimes that can kind of help to ease some of the stress and particularly some of the emotional feelings about I'm being away from my baby or my child for the first time maybe ever. Or if you're not going to do that, you could at least say, okay, I'm going to start on Thursday, so that at most I'm working maybe Thursday, Friday, maybe Saturday if something that you do, and then it's the weekend again and I'm home with my child. I'm not going to start back on a Monday when I've got to kind of slog through the whole week for my first time back. Some people are ready. Some people are just like, I missed it. I can't wait. Like, get me out of my house and get me back to work. And if that's you and you're feeling really great about it, then hey, maybe you don't need any changes at all. But for those who are a little anxious about the idea, I think it can be helpful to kind of start a little bit slow, or at least have the weekend come a little bit faster. For some people, it'll be helpful for them to have a couple practice days with whoever's going to be watching the baby, whether it's family or spouse or partner or daycare or babysitter. Just leave them for a few hours or a day or something like that, kind of ahead of time, so that you can get used to saying goodbye, walking out the door, leaving, that kind of thing, coming back, seeing that your baby's fine. That can help to reduce stress. So you're not doing all of that for the first time on the day when you then need to be at work and show up and be a functional human being, which I never felt like the first couple of days when I was back at work. I was like, I just want to talk about my baby all day and cry. Like, what do you mean I can't do that?
Generally, it's like at 3 to 4 months, and that's when the sleep deprivation becomes really real, right? I mean, that
Oh yeah,
catches up
it's
with
just never
you
ending
for
for
me.
me, but
Yeah.
yeah, and you may also, some individuals are going to be dealing with, mental health concerns as well, postpartum anxiety, postpartum depression, other perinatal mental health disorders. I mean, your world can be just totally rocked, so it's a lot. Even if it's, you think well, this is just what I've been doing, like I know how to do this, like why is it so hard? It's because your entire world has changed. It is really hard. If it feels really hard, it's not because you're doing something wrong or you're not good enough. It's because it's just everything is different. Everything is different. So, giving yourself grace when you kind of ease back into things, I think is really important, because I don't know, I just think we tend to beat ourselves up so much, just about everything. Why didn't I know what to do with that case? Like, why didn't I do a better job talking to that owner? Like, why didn't I do that surgery faster? Why am I not suddenly perfect at being a parent and working veterinary professional at the same time? Because it's really hard. That's why. And I mean, none of us are. So I think just trying to have that little piece of understanding and support and validation for yourself is so important. And then there's all the other stuff. I mean, if you're pumping, you've got to get all your pumping stuff together. You've got to figure out if you're having to drop your child off somewhere on the way to work, how much extra time is that going to add? So there's a lot to be said to kind of doing a run through, maybe like a practice run, a day or so or a week or so ahead of time, so that kind of how long it's going to take and what the traffic conditions are going to be like at the time when you're going to work. And then having a picture of your baby to have on your desk or on your phone or wherever it is, And that's actually been shown to help with milk letdown if you are pumping, is to look at pictures and videos of your baby while you're trying to pump, which is its own journey. And I'm not the expert there, even though I've done it a bunch of times. There's a lot. There's just so many parts of it that can be challenging and stressful that I just think we need to be gentle and kind to ourselves and keep talking about it so that others know that they're not the only one that's kind of struggling with any of these things.
Thanks, Emily. I mean, well, we touched on a few things, but we could talk. I mean, I just think of all the topics we could talk about. But
Yeah,
luckily for us,
going.
you did write a book. So tell us about your book and where we can get it. If somebody is going through this, whether they are thinking about pregnancy, whether they are pregnant, whether they've just given birth, like your book is a great resource for them. I'd love to know more about it.
Yes. So my book is titled Pregnancy and Postpartum Considerations for the Veterinary Team. It is published by CRC Press. It's available now. It is so it can be purchased. Probably the easiest way to find all the ways to purchase it is, I mean, you can Google it, but you can also go to my website, which is emilysinglervmd.com, and it has links to purchase at several different locations, Amazon from the publisher and other locations as well. So that's probably the best way to find it. It is meant to be, I call it a handbook, a manual, whatever you want to call it, for veterinary professionals. And I truly mean that, every member of the team. It's not just for veterinarians. It is meant, the first 6 chapters are, they cover the workplace hazards. We talked about some of them today. So radiation, anesthesia, infectious disease. Then we also go over drugs and chemicals, injuries and ergonomic hazards, stress and fatigue. And then we get into some other more logistical aspects of pregnancy. So we talk about trying to conceive, infertility, pregnancy loss. We talk about announcing your pregnancy at work, telling your employer that you're pregnant. Workplace protections, that kind of stuff. Planning your parental leave. We talk about being on leave, being at home with the baby, kind of all the changes that can go along with that, mental health and perinatal mental health disorders. And then we talk about going back to work and everything that goes into that, finding childcare, deciding about pumping, getting ready for the first day, what it's like to be a working parent and all the different struggles and all the ways that we can help make it easier for ourselves and for those that, that we work with. So tried to make it very comprehensive. And I also include a lot of short stories, the experiences of other moms who work in veterinary medicine and what their experience has been like, what they've learned, what's been helpful, that kind of thing, so that you're not just hearing from me, you're hearing some of their experiences and some of their insight as well. So it's available now. My hope is that it'll be valuable to those who are going through it themselves, but my hope is also that employers and practice managers will pick it up and look at it themselves so that they know how to better support their staff, and so that they have it on their shelf. I really feel strongly, if you could just have it on your shelf where anybody in the practice can access it, and that way they can look at it, they can look something up for themselves, and they don't have to tell you. They don't have to tell anyone. I think it's so important for people to be able to access that without having to, disclose what their concern is before they're ready. So it's great to just kind of have it there on the shelf for anybody who needs it.
Thanks, Emily. What a great resource. I wish it had been available when I was pregnant with my kids.
I know, me too.
But happy for everyone else that they've got this resource. So thank you so much for your time. It's been wonderful chatting to you. And for those of you that would like to buy that book, you can have a look in the show notes, and we will add a link to Emily's website. Thank you so much, Emily.
Thank you so much for having me.
Take care. Bye-bye.
Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacor. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at curacor.org. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of August, 2024. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.